Eslicarbazepine tablet is used to treat a certain type of seizure disorder, known as focal seizures. It can be taken alone or with other medications. Eslicarbazepine belongs to a class of drugs called anticonvulsants, which work to reduce the number of seizures you may experience. The daily dosage and the optimal timing of taking this medication will depend on your specific condition and your doctor's recommendation. Be sure to follow your doctor's instructions carefully for the best results. Before you start taking eslicarbazepine, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage is based on your medical condition and response to treatment. Children's dosage is also based on weight. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Use this medication regularly to get the most benefit from it. Take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when this drug is suddenly stopped. Tell your doctor if your seizures worsen. Some common side effects of eslicarbazepine tablets may include headache, shaking, drowsiness, tiredness, dizziness, nausea, or vomiting. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. However, it's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Be sure to notify your doctor right away if you experience any serious side effects, such as uncontrollable eye movements, blurred vision, signs of infection, easy bruising or bleeding, or pale skin. Additionally, some individuals taking anticonvulsants like eslicarbazepine may experience mental or mood problems, so it's important to seek medical help if you or your family notice any sudden changes in mood or behavior. In rare cases, a serious allergic reaction to this drug may occur. If you notice symptoms such as fever, rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not mentioned here. Before taking eslicarbazepine, it's important to let your doctor or pharmacist know if you have any allergies to eslicarbazepine, oxcarbazepine, carbamazepine, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist for more details. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, or mineral imbalances such as low levels of sodium in the blood. Eslicarbazepine may cause dizziness, drowsiness, or blurred vision. It's important to note that alcohol or marijuana can increase these effects. It's advised to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, cannabis, it's important to discuss this with your doctor. Before undergoing any surgery, it's essential to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness or loss of coordination. During pregnancy, it's important to use this medication only if clearly needed, as it may harm an unborn baby. However, since untreated seizures can also harm both a pregnant woman and her unborn baby, it's crucial not to stop taking this medication unless directed by your doctor. If you are planning pregnancy, become pregnant, or think you may be pregnant, it's important to immediately discuss with your doctor the benefits and risks of using this medication during pregnancy. It's also important to discuss reliable forms of birth control with your doctor, as hormonal birth control may not work if taken with this medication. This medication can pass into breast milk, so it's essential to consult your doctor before breastfeeding. It's important to be aware that eslicarbazepine tablet may interact with other medications, potentially affecting how they work and increasing the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include orlistat and rilpivirine. This medication may also decrease the effectiveness of hormonal birth control, such as pills, patch, or ring, potentially leading to pregnancy. It's important to discuss with your doctor or pharmacist whether you should use additional reliable birth control methods while taking this medication, and for at least one menstrual cycle after the end of treatment. Additionally, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. If you are taking other products that cause drowsiness, such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers, be sure to inform your doctor or pharmacist. It's crucial to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. You can ask your pharmacist about using those products safely. Eslicarbazepine is very similar to oxcarbazepine, so it's important not to use medications containing oxcarbazepine while using eslicarbazepine. Lastly, this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform all lab personnel and doctors that you are using this drug. If someone has taken too much Eslicarbazepine tablet and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important to act quickly in these situations to ensure proper medical attention is received. It's important not to share this medication with others. Before starting this medication and while taking it, your doctor may want to conduct lab tests to check your sodium/chloride levels and liver function. Make sure to keep all your medical and lab appointments. If you have any questions, consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. Make sure to store Eslicarbazepine tablet at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. Do not flush Eslicarbazepine tablet down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.